When we think about fighting an epidemic, our minds usually jump to vaccines, high-tech labs, and hazmat suits, right? But what happens when the biggest hurdle isn't the virus itself, but us, our behavior? Today, we're going to break down a lesson that completely changed the game, learned from one of the deadliest outbreaks in modern history. I mean, think about it. It seems completely baffling. You have expert medical teams showing up with life-saving knowledge and gear, and yet, the community turns them away. They hide their sick relatives. They keep doing the very things that are spreading the disease. Why? Well, the answer to that question gets to the very heart of how we have to manage these global health crises. So, to really get this, we've got to go back to West Africa in 2014, when the Ebola virus was just tearing through communities. And here's the critical thing you have to understand about Ebola. It spreads through contact with bodily fluids. This meant that the single most dangerous moment was also a moment of incredible grief and tradition, the funeral.
And this right here, this is the core of the conflict. On one side, you have these sacred burial rituals that go back generations. It's how families show love and respect by washing and preparing their loved one's body for the afterlife. But on the other side, you have the brutal reality of the Ebola virus, which turns that final act of love into a moment of extreme risk. So when outsiders just show up and say, stop doing that, it's not just a health directive. It's a clash with culture, with love, with faith. It was never going to be that simple.
So, as you can probably guess, the initial response really struggled. The virus just kept spreading. It became painfully clear that the international teams were missing a huge piece of the puzzle. They were fighting the virus, sure, but they weren't seeing the bigger picture it was spreading in. And then, this incredible insight came from a local doctor in Sierra Leone. He said Ebola is a three-legged animal: medical, political, and social. The international response was pouring everything into that one medical leg, but the whole thing was just falling over because they were ignoring the other two, especially the social one. Now, what's really fascinating here is that the World Health Organization kind of knew this already. They'd actually been putting anthropologists on the response teams for years, but here's the catch. That knowledge wasn't really baked into the core strategy. It was more like an add-on. The system itself was still built to fight a purely medical battle. So, to figure out what was really going on, the social scientists on the ground started using this simple but honestly brilliant framework. It's designed to break down why people do what they do, and it's called know, want, can. Here's how it works. First, you've got know. People have to actually know the facts, that touching the body is dangerous. Simple enough, right? But knowing isn't enough. That brings us to want. They have to want to change their behavior, to decide that safety is more important than the traditional way. And finally, even if you know the risk and you want to be safe, you get to the can part. Do you have the ability to act? If you call the official burial team, can you trust them to even show up? And will they treat your loved one with dignity? If the answer to that is no, then the first two steps are basically useless. And applying this know, want, can thinking, well, it completely changed the game. It sparked this huge shift away from just barking orders from on high and moved toward actually working with the communities to find solutions that made sense for them. Let's look at the before picture. The first approach was pretty blunt. Just ban the rituals, burn personal belongings to decontaminate them, and the result? It was a total disaster. All it did was create massive mistrust. People started hiding their dead and holding secret, unsafe burials, which, of course, just kept the virus spreading like wildfire. But now, check out the after picture, the adapted approach. This is where things got really smart. Responders started collaborating with local religious leaders to find ways to make burials both safe and dignified. Instead of burning personal items, they were placed respectfully in the coffin. A social communicator joined every burial team to explain what was happening. Families could even follow the burial team and watch from a safe distance. See? These were small, respectful adjustments that made all the difference in the world. What this really was a fundamental shift in perspective. Responders stopped seeing a community as just a dot on a map. They started to see it for what it truly is, a complex social network, a web of people all connected by relationships and, most critically, by trust. You simply can't treat individual cases without treating the network they belong to. And as the WHO's Sylvie Briand points out, this had a really cool side effect. It didn't just help the communities, it actually changed the responders. It opened their eyes to the social realities on the ground, which naturally led to much better, more empathetic communication. And that is what started to build back the trust that was so desperately missing.
So the big takeaway here is that the success in fighting Ebola this way wasn't just some one-off thing. It signaled a whole new way of thinking, a lesson that holds true for any outbreak anywhere on the planet.
And you can see this same principle at work in totally different situations. For instance, during a cholera outbreak in Côte d'Ivoire, it was social scientists who quickly figured out that latrine cleaners were a huge high-risk group, something a purely medical approach might have missed. Or take the 2009 flu pandemic in France. It helped explain why mass vaccination, which worked great elsewhere, was met with so much resistance there. It always comes down to the local social context. Which brings us to the bottom line. There is no such thing as a one-size-fits-all solution in public health. It just doesn't exist. You can have the best medicine in the world, but if you don't understand the culture, the beliefs, and the social fabric of a community, your response is doomed from the start. Context is absolutely everything.
And that leads us right to the big call to action from the experts who lived through this. For future crises, the goal has to be making social science a core part of the plan from day one, not something you scramble to bring in when everything is already on fire. So it all comes down to this, doesn't it? The evidence is clear. Listening is just as important as lecturing. Empathy can be as powerful as a vaccine. So for the next pandemic, and we all know it's a question of when, not if, the real question is, are we truly prepared to listen?